alaikum wa rahmatullahi wa barakatuh. So this is another teaching station discussing about how to teach about Partogram. And I know Partogram is somewhat difficult to read or to fill if you don't, if you are not familiar with doing that. And usually the midwives will use it for recording for the labor events, but we need to know how we fill and how we read it. Okay, so what is the Partogram? So first of all, we will do as any teaching station. You welcome your colleague in the department, ask him if he is facing any problem, and offer your help and support. And you are aware that he is coming to learn about Partogram. Ask him why he wants specifically to learn about that topic and appreciate his initiative and so on. So first of all, I will just give you the what Partogram looks like, and we use what we call 4 hours action line Partogram. What is the meaning of 4 hours action line? That means that the period between the alert line and the action line is 4 hours. Okay, so we use the 4 hours action line, and we start only the Partogram in active phase of labor. We don't start Partogram in the latent phase. And also, if the patient, for example, came to you 6 centimeter dilated, so we'll start from that point. We will not start from 4 centimeters. She passed this time already. So we'll start the Partogram from where the patient was in terms of cervical dilatation at the time of admission. But if it came in the latent phase, we will not put the Partogram in the latent phase. Okay, so what is Partogram? Is a graphical record of labor events, and it's recorded against the time frame in a single sheet of paper. We will have everything in the same paper. Okay, so as I told you, it's a 4 hours action line. So what we have in this graph, if you look at the area of cervical dilatation, I know the numbers and the writing is very small to you, but I can just, I don't know if I can mark it here. So I'm really sorry. So just skip the first block of squares. This is for the fetal heart rate. Below that will be the liquor and molding, and after that the cervical dilatation. Okay, so the area of cervical dilatation, you will have the alert line and action line. Okay, so we'll start once the patient admitted. We assume that her progress is coming in parallel to the alert line. Okay, and if it crosses the alert line at any mean, that means her progress is still, we can wait, but we need to keep an eye. We will not take an action until the progress of labor comes crossing the action line. Okay, okay, so what are the parameters of the Partogram and how to fill it? So first of all, if you look in the beginning of the sheet up, there is the details of the patient. So we need to write the full name of the patient and how much gravity and parity, what is the hospital number, and when is the date of admission, and whether the membranes are ruptured or no, and if it is ruptured for how many hours. Okay, So date and time of admission is very important. So the patient detail as a full, and if you have a label sticker for the patient, it's better to put it on the paper itself. Okay. So coming down to the maternal observation, it's down in the bottom. You will see the urine, and above that is the maternal observation. Observation means the vital signs. Observations is the pulse, blood pressure, and temperature, okay, and respiratory rate for sure. So the maternal observation should be put. Once the patient is admitted, we will see the observations. So you will put the systolic blood pressure in the form of a mark, like I will just show you in a blank one. Yeah. So systolic blood pressure, we make it like that. And diastolic blood pressure, we make it like that. And if we need to mark the pulse rate, we'll do a circle with black dot like that. Okay, so like if you have the numbers, like for example here 140, for example, and here 120, sorry, 30, and 120, 110, 100, 90, 80. For example, I need to record the systolic blood pressure 130/80. So how I will mark that? I will put the systolic blood pressure, which is in the form of that here, and diastolic is that here, and the patient pulse is 100, so I will put this one here. Okay. Okay. Okay, coming back to the partogram. So here, downward, as you can see on the screen, we have the numbers, we have the blood pressure. Either it's like an arrow like that, you can put it in a range like that, with arrow up and arrow down, and connect them in between with a line, or you can just put the two marks and it will be known. And the pulse with a dot, okay, and measure the patient temperature and record it down here in the square below the blood pressure and pulse. Okay, so after that we need to listen to the baby. So we first of all, if you take the patient once she's admitted, you will know her details, put it accordingly, sorry, and after that, you will take her observations and put it accordingly, and then you will listen to the baby to confirm the baby is pulsating. Okay, so once you listen to the baby, we need to record the fetal heart rate. Okay, so the upper part of the partogram here is the fetal heart rate. Okay, we will put it accordingly where it is, and we need to record that every half an hour in the first stage and every 5 minutes in the second stage, if the patient is not on CTG. Okay. Okay, so now we know the patient observation. We listen to the baby. Patient will lie down on the bed. We'll do labor assessment. Okay. So first of all, if she's having ruptured membrane, we need to document in the square of Likor just below the fetal heart rate. So how we will document about the Likor in the partogram? We have letters. If the membrane is intact, is not ruptured, we will write the letter I in the square. Okay? So if it is ruptured, so if it is intact, we'll write I. If it is ruptured, we need to write either of these three letters, either C, B, M. What C stands for? Stands for clear liquor. What B stands for? It stands for blood-stained liquor, and M stands for meconium stained or meconium passing meconium. Okay, so either I for intact membranes or CBM. C is clear, B bloody or meconium. Okay, and how frequent we need to record that? Every half an hour. Okay, so every half an hour I need to record the baby heart rate and the liquor, color of liquor, or it's either intact or ruptured according to the situation. Okay, and the molding is the one which is below the liquor. Okay, we will not do the molding unless we have done VE or vaginal examination. Okay, so the molding is, you know, can be with 0 to +3. We can no molding, we will put 0. If it is mild, we will put +1. If it is moderate, we'll put +2 molding. If it is severe molding, we'll put +3. Okay? The same if we have caput, we can put it, but I don't know if there is area to document if there is any caput here. I'm not sure, but usually in some of the partogram there will be a square for caput. Okay. Okay, then the next square is the most important part of the partogram, which is the cervical dilatation area. Okay, so according to how many centimeter dilated, we will mark and we will examine the lady. If everything is going well, our examination is after 4 hours. So every 4 hours we examine the patient. Okay, and then we will record how many centimeters they are, and actually we expect that she will be dilated 1 centimeter every 1 hour. Okay, as you know, if it crosses the alert line, that means that we need to keep an eye on the patient, but if it crosses the action line, that means we need to take an action. And here we need to record the time of the examination done. In the down squares, you have the time record, how many hours. Okay? Okay. In the same area of the cervical dilatation, we have a subtitle of the descent of the fetal head. So the fetal head station, you can just record it here, okay, with O figure. Like if it is the descent to -2 station, for example, so I will write it here on 2, okay, or -2, and I will write O. Okay, so the descent of the fetal head, it ranges from 0 until 5, and we need to document where is the head exactly. Okay, and also the next to that is the contractions per 10 minutes. There are some squares down the section of the cervical dilatation is for the contractions. How we document the contractions. So every column contains 5 squares, as you can see, 1, 2, 3, 4, 5 as a column. Okay, so how many contractions in 10 minutes? If it is 1, I will mark only 1 square from down. If it is 2, I will mark 2 squares. If it is 3, I will mark 3. If it is 5, I will mark the whole 5. And how to mark that? So I will just show you. So if we have this column like that, 1, 2, 3, 4, and 5. These are the columns for contraction. So this lady is having, for example, 2 contractions lasting for 20 seconds, and they are weak contractions. So she has 2 contractions. That means I will just mark these 2 squares. So it's weak contractions, so I will mark it in a dot manner like that, because it's weak contractions. Okay, and lasting from 20 to 40 seconds. So if it is lasting from 20 to 40 seconds, if it is weak, I will mark it as a dots, some dots. If it is moderate contraction, then I need to mark it in like lines like that, and should be lasting from 20 to 40 seconds. But if it lasts for more than 40 seconds, or if it is a strong contraction, I need to color the square in full. Okay, again, if it is weak and lasting from 20 to 40, I will mark it as dots. If it is moderate and lasting from 20 to 40, I will mark it as lines. If it is strong or more than 40 seconds, then I will need to color the full square. And according to how many contractions, I will mark the numbers of the contractions. So again, if I have this column, 1, 2, 3, 4, 5, and I'm telling you this lady is getting 2 contractions in 10 minutes, and they are strong and lasting for 60 seconds. So I will mark 2. This is the first one, and this is the second one. So if I found this area is colored like that, that means she is getting 2 contractions in 10 minutes, and these contractions are strong or lasting more than 40 seconds. Okay, another example. One, two, three, four, 5. So I'm telling you this lady is getting 3 contractions in 10 minutes. They are moderate and lasting for 30 seconds. So moderate, lasting from 20 to 40. Then I need to mark them in lines like that. So she's getting 3 contractions in 10 minutes. So I need to mark 3 squares like that. Okay. So this is how we record the contractions in the partogram, and this is the square down here. And after that, we need to show or to write if the woman is having syntocinon started or no. So if I put syntocinon, I need to write how many units and how many ml per hour. So how many per minute, I mean. So how many units? For example, I'm putting 5 units. So I will write here 5 international units in the upper square. I will write 5, and then I'm running them in, uh, for example, 1.2 ml, and then I have to write that rate in the below square. So in the upper square, I need to write how many units. In the lower square, I need to write the rate of sentinel running. If the patient is receiving IV fluid during labor, I need to write it here in the blank square. What kind of IV fluid, whether it is Hartmann's or is there anything ringer, any solution running, and if we add any IV drugs or anything, we need to write. Sometimes the patient is receiving intrapartum antibiotics. For example, she's GPS positive, so we need to write down here the antibiotics she's taking, or if she's receiving painkiller IV in the form of IV like a paracetamol, we can just write it here. So any IV fluids or drugs we need to write here. Okay. Okay. And as you can see, the lowest part of the partogram is the regarding the urine. So if we suspect any problem in the urine, we need to do the urine diagnostic. If we found protein, if we found acetone, if we found anything in urine, blood, or anything, leukocytes, whatever, we just write it here in the square and how much the volume of the urine she's voiding each time. Okay, so what is the importance of that partogram? Because we are changing our shifting in a specific times, so it helps us to have a look about what happened previously in, like if you came like at 8 a.m. in the morning or 9 a.m. in the morning, you take your labor room and then you feel that this lady is not progressing well. If you have a look on the partogram, you will know what happened during the night time, whether she was having a good progress or no. So it helps to help the continuity of care, and also it's for the patient safety to know everything about what happened in labor. So if we have a recording of the partogram, for example, of the full delivery process, and by the time the patient went to theater for an emergency C-section, when she came for counseling for the next pregnancy, and we can just review the partogram to have an idea about what was going on in her last delivery, to see how much her successful chance if she wants a VBAC. So it gives us a very important information, either in the short-term run or on the long-term run as well. Okay, so it's usually filled by the midwives, but we can have a look on it. But it's very important. We have to know how to fill, how to read, because if you don't know how to fill the things, you don't know how to read. Okay,